What's the Tommy John ligament? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. Yes, I usually talk about the knee, but today we're going to talk about the elbow because the same principles apply for any regenerative medicine technique. It works in all areas of the body. So the Tommy John ligament is the ulnar collateral ligament. You see that little green thing right there? It's about that small, and it's along the inner, the medial side of the elbow. And when people throw, there's a lot of stress on that. And when that tears, that's the old Tommy John injury or ulnar collateral ligament injury. Now, traditionally, the surgery for that was to make a big incision, move this nerve out of the way, drill tunnels, take a tendon from somewhere else and weave it through there, and that's the Tommy John surgery. But now with regenerative medicine techniques, if it's not a complete tear, and sometimes even if it is in a younger person, we're able to get that healed using regenerative medicine techniques like PRP, platelet-rich plasma, and bone marrow aspirate cells, which has stem cells and other cells that help the stem cells. Here's a great example. This is a 17-year-old high school baseball player, and the humerus, the arm bone, is right here. Here's the inner side of the elbow, and here's the ulna. And so the ulnar collateral ligament is on the inner side, the medial side. This is the quote-unquote funny bone area, and ligaments are black. They connect bone to bone. And so you see this ligament coming up here, and then you see it kind of gets kind of white right where it's going to attach to the elbow, inner part of the elbow here, and that is a partial tear of the ulnar collateral ligament. And also muscles are kind of grayish, and you see this white area. So there's some tearing of the flexor pronator muscles that also protect that ligament. And this person got injured in a tournament down in Florida. They started feeling better because the radiologist read this as normal, even though it's not normal. And then they were throwing, and now they really tore it. They tore this muscle really bad, and they tore up here where the ligament attaches to the bone even worse. You see all that white signal there. So what we did was we injected bone marrow aspirate cells, which has stem cells and other cells that help the stem cells, PRP, into the torn area using an ultrasound and a needle after we numb the area up. And then this person was still having pain, and it was not in the area where the ligament was, so we MRI'd it, and we got this image of the ligament that looks absolutely perfect. The muscle is completely normal, no more white signal in it, no more white signal in the ligament, completely normal. So we knew it wasn't the ulnar collateral ligament that had healed. It was actually the tip of the elbow where there was a stress fracture, and I'll show you that here in a second.